Have you ever been so tired during the day that you feel like you need to put your head down because you're about to fall asleep? If you answered yes, then you are experiencing what people with narcolepsy experience on a daily basis. The four main points that I will talk with you about today is what is narcolepsy, what are its symptoms, what causes narcolepsy, and how it can be treated. It is assumed that people spend a third of their lives asleep. Narcolepsy is a condition that many people, both male and female, have. The condition normally starts as a child, but it can appear later in life for some people. Every 1 in 2,000 Americans are diagnosed with narcolepsy. However, it is a condition that is unrecognized and undiagnosed many of the time. Narcolepsy can be defined as a neurological disorder caused by the brain's inability to regulate sleep-wake cycles normally by the National Sleep Foundation. A person with narcolepsy gets tired very easily during the day, even if participating in something that keeps their adrenaline going. Not only do they get really tired during the day, but also experience sudden outbursts of sleepiness that is irresistible and uncontrollable. This condition can affect a person in things that they do every day. They can fall asleep while working, while at school, eating, or even driving. According to Ellen Kawana, narcoleptics have 10 times more automobile accidents than people who are not narcoleptics. Even though narcolepsy is a condition where a person can sleep at any time, narcoleptics do not get any more sleep than the average person. They just don't decide when they get to sleep or how to regulate normal sleep cycles. Sleep cycles include NREM, which is non-rapid eye movement, followed by a period of REM, which is rapid eye movement. A normal sleep cycle lasts about 8 hours with 4 to 6 different sleep cycles. It also consists of 100 to 110 minutes, starting with NREM, then moving to REM 80 minutes afterwards. People with narcolepsy usually enter into REM a few minutes after they fall asleep. There are 4 main things to look for when trying to determine if one has narcolepsy. These major symptoms include excessive sleepiness, cataplexy, sleep paralysis, and hypnagogic hallucinations, according to the book edited by Santos, Guillermo, and Villalba-Latour. Cataplexy is a sudden bilateral loss of postural muscle tone. According to the National Institute of Neurological Disorders and Stroke, every 1 in 3,000 Americans are diagnosed with narcolepsy that contains cataplexy. Sleep paralysis is when a person cannot move their limbs immediately after they wake up. Lastly, hypnagogic hallucinations are visual images that are seen while sleeping that seem very real and lifelike. Other things that may be seen in a narcoleptic person include problems with concentration, attention, memory, and performance. When people develop conditions in their life, most of the time there is a probable cause as to why they have it. With narcolepsy, it's slightly different. Narcolepsy has an unknown cause. According to the Mayo Clinic, narcolepsy may have something to do with genetics or other factors, including infection, exposure to toxins, dietary fibers, or stress. There are also other things that are suspected contributors to narcolepsy. Hypocretin, which is a neurotransmitter promoting wakefulness, is lacking in a person with narcolepsy. When cataplexy is involved, the person may lack brain cells that produce hypocretin, but professionals are not very sure why. Lastly, but in the most rare cases, the person may have suffered damage to the brain or tumors in the brain that have affected the part of the MRE sleep. In order for a doctor to figure out if a person has narcolepsy, there is different tests that can be ran. The first test that may be performed is a sleep study done by a sleep specialist. While in a sleep study, there are 2 tests that can predict narcolepsy. The first is a polysomnograph. This test records brain activity, eye movement, heart rate, and blood pressure. The second test is called a multiple sleep latency test. It is a test that is taken during the day to measure how sleepy you are. It is normally conducted after the polysomnograph. Some doctors may also perform a hypocretin test. This test measures the level of hypocretin in the body. In addition to figure out someone has narcolepsy, the doctors can also advise the patient on how to treat it. The treatment of narcolepsy differs for each symptom. Cataplexy is treated with sodium oxybate, tricyclic antidepressants, or selective serotonin and noradrenaline reuptake inhibitors. Sleep paralysis, hallucination, and fragmented sleep may be treated with sodium oxybate. Patients with narcolepsy should follow proper sleep hygiene and strong emotions. Overall, narcolepsy can be detrimental to a person's daily life. It affects the way they live and the activities they perform in. It makes them very sleepy, have sleep paralysis, cataplexy, and even hallucinations. However, it can be treated with correct medicine to correct the possible symptoms. If you know someone with narcolepsy, be sure not to take it lightly because in extreme cases, it can become harmful.